Welcome all the dignitaries, the eminent speakers of the present technical session. We are expecting Dr. Shastri to join very soon, but since the time is passing out, so what I try to do is that let me introduce the chair first, and then I think as soon as he will join, we'll take it up. But we can continue our this session, and the speakers can deliver their address. So this session is a very important session, right? There's the business session 1. This is global market potential of medicinal plants and recent market trends. We have 4 eminent speakers on this very important issue. They are Mr. Richard Harvest, Director, Stevia Private Limited, Durban, Republic of South Africa. We have with us Dr. C.K. Katiyar, Chief Executive Officer, Technical Healthcare Division, Imami Limited. We have with us Mr. Shoikat Kumar Basu, Executive Director, Performance Seed, Saint South, Lethbridge. So, Executive Director, Performance Seed, Saint South, Lethbridge, Canada. And we have with us Sri Saurabh Sharma, Manager, Marketing and Trade, National Medicinal Plants Board, Ministry of Ayush, Government of India. And so our chair is Dr. J.L.M. Shastri, who is the Chief Executive Officer, National Medicinal Plant Board, Ministry of Ayush, Government of India. He is as present CEO from January 2020. He was earlier Head Clinical Research in Durban from 2004 to 2007. He was Head Healthcare Research, Durban, 2012 to 2020. Now, may I request our first speaker, Mr. Richard Harvest, who is the Director, Stevia Private Limited, Durban, Republic of South Africa. Richard has a bachelor degree in economics and computer science, having founded or co-founded several business entities. Richard has a keen interest and background in entrepreneurial startups. Richard was regional economist at South African Cane Growers Association for 6 years, followed by 3 years as innovations and technology manager before leaving to take up the reins on Stevia full-time. So I request Mr. Richard Harvest to please deliver your address, and also try to include the possibility of overseas collaboration and investment as one of the issue of our discussions. With this, I request Mr. Richard Harvest to kindly take up.
Thank you very much for the opportunity. I'm very grateful to be here today, and I will share my screen shortly. I have a short presentation. It's great it's nearly 12 o'clock in South African time, and it's really good to be virtually in India. So let me just share my screen and take you through my presentation. So yeah, the company is called Stevia. We started in 2019. We raised some money and got some shareholders from the sugar industry. As you saw in my background, I'm from the sugar industry. And sugar has been under a lot of pressure in South Africa for a number of years. So we were looking for diversification crops, for sustainability, and particularly looking for things which are healthy. There's obviously a huge health trend around the world for consumers looking for healthy alternatives. So once again, thank you for the opportunity to talk to you today. So I just want to talk about our collaboration with India briefly. It's a very important part of our project. Last year, at about this time, February, myself and a colleague, Mr. Kurt Stock, visited India. We landed in Calcutta, and then we went to Jabalpur, Bidar, and back again. It wasn't by car, as this map suggests, it was by plane, but and please excuse my pronunciation of the city names, but we had an excellent trip. Mr. Shantanu Chakraborty assisted us, and we've had a very close collaboration with Shantanu over a number of years now. And again, we met a lot of very interesting people. Everyone was willing to share, to collaborate, to tell us about the challenges and how to overcome them. So it was a fantastic trip. And in fact, it wasn't my first trip. I was in Calcutta about 2 years before that on another trip, also just to investigate stevia and what's happening in India. So the collaboration between our project and India is extremely close. This is actually a picture from our trip last year, February, at the university there, which we really enjoyed seeing the facilities and speaking to people there. We were able to present at a conference there. The top left is Mr. Kurt Stock, a farmer and director of stevia, who attended with me. And it was really a very interesting stopover and stay last year. So let me just talk about the development targets for stevia. We are a very new company. And so our first goal was to see if we could successfully grow stevia in our various climatic zones. I'll talk about where we're growing it shortly, but that was the goal number one. Can we grow stevia? We come from a farming background, so our interest starts on the farming side and moves through the value chain. The next step, and we are again collaborating with Indian companies on this part of it, we want to commission some processing plants. Stevia is grown in Africa. A small amount is grown in Zambia and in Mozambique. But those countries export their dry leaf, and we want to be part of the entire value chain. In the sugar industry, farmers have only provided sugarcane and not participated in the value chain, so we want to change that. So we want to produce our own stevia, and not just stevia, but quality stevia and quality formulations. We don't want to be a supplier of the commodity version of stevia, the raw stevia. We want to have good collaboration with formulation companies and flavor houses in order to produce high quality formulations. And in this instance is also, we've had some products from India. We've blind taste tested them with products available in South Africa, and we found them to be excellent. So we hope to do more collaboration on that side. We want to establish marketing channels. That's obviously when we're a bit further down the track and we actually have products to share. And again, marketing channels are essential. Can you produce it is one question. Can you sell it is obviously another. That's where we hope to have a lot of collaboration with India and elsewhere in order to export our product once we meet local market needs. And then to achieve break even. So we're quite fortunate that we raised money from 97 farmers and farming organizations in order to launch this project. So we're not in a rush to meet a break even requirement in the short term. We have a very long-term goal. Sugar has been cultivated here since 1860 odd. And we hope stevia will have a very long and very successful run here. So it's not a short-term project thinking, but break even would be nice in the next 2 to 3 years. So the main thing I want to talk to you about today is our farming and trials, because that is the first part of our project and the part where we believe we've achieved some success to date. So here you can see one of our trials. The farmer on the left is Mr. Quentin Benningfield. He's running this trial operation. He's a large sugarcane farmer. In the background, you can actually see sugarcane. So this here is sugarcane. He's got some peppers here. So he's a large sugarcane farmer, and this was one of our first trials and very successful. If you look at this picture now, it's very interesting because obviously June, July is our winter. So this was during the middle of our winter. On the left, you can see that same plantation you saw in the previous slide was harvested on the 3rd of June, and exactly 8 weeks later, it looked like this on the right. So the growth was fantastic, and this was a particularly cold winter, one of the coldest in 10 to 15 years, and yet the growth has been really good. So we're really pleased by that. Another part of our success in South Africa, and why we believe we can be a world player, is that we have very sophisticated and world-class facilities. This is our commercial nursery that we partnered with in a town called Greytown. On the top right, this picture here, you can see is our mother block. These plants were produced from 30 original seedlings, and this is where all the seedlings are taken from. And then you can see on the left-hand side in the bottom picture, these are seedlings that have been produced in order to go out to commercial farmers. All of these, and in fact, almost all the plants you'll see today came from those original 30 seedlings. And this variety is looking extremely promising in South Africa. So, yeah, it's state-of-the-art facilities. They have concrete floors in the seedling facility with underground hot water heating that goes to the concrete, so temperature maintained all year round. So, a very sophisticated operation. This is a tunnel that we're setting up on Kurt Stock's farm in Pongola. We don't want to have all our eggs in one basket, as they say. So we are improving our variety, and we are developing other varieties for disease resistance, for suitability to different climate zones. So this is another small facility. It's about 400 kilometers from the commercial nursery you saw. And the idea is to separate our plant, not have all our risk in one place, and also to continue to develop. So I just want to talk about where we're doing this in South Africa. So obviously this is a map of South Africa. We have trials in KwaZulu-Natal. So this is the very arable part of South Africa, is Natal and this Mpumalanga area. The bulk of South Africa, this whole western part, is very dry. In fact, South Africa only has about 3.5% arable land. So we're doing it in KwaZulu-Natal and Mpumalanga, which is also where we grow our sugarcane, because it's more tropical or subtropical climates in these areas. And more specifically, if we look at KwaZulu-Natal itself, so Durban is the third biggest city, and I believe one of the biggest Indian communities in the world outside of India. So Durban is where I live. We are growing on the south coast, so it's a bit cooler on the south coast. We've got 2 trials in the Midlands. And it's quite cold there. In winter, it gets below 0, and that's because of its fairly high altitude. In Pangeni, Felixton area, about 170 kilometers north of Durban, is where Quentin Bedingfield's trial, the picture you saw earlier. And then Pongola, where Kurt and a few other growers are based. Pongola is a very good growing area. It's very hot, very humid. Lots of clear skies, so it's actually quite a dry climate, but they have irrigation water in abundance, so it's a fully irrigated area. And I'll show you some results from there. And then in Mpumalanga, this is where we're also growing, and here we're growing it near the Mozambique border. So this is also, it is the best growing area in the country. Very hot, very humid, known as the low veld, and extremely good soils and growing conditions. So we have our highest sugarcane yields there by a long way. And also, we expect to have very high stevia yields there. So now, just to show you some of our actual plantations. This is a trial in the Midlands, so one of our colder areas. This is planted at the beginning of winter, and this is sort of midwinter this picture was taken. And as you can see, the stevia is looking fantastic. Very, very little flowering, very dense leaf development. Tests so far show a very good stevia glycoside content. So we're very excited about the Midlands. We weren't sure whether in these colder conditions it would grow well, but it's proven to grow extremely well there. So one of our very successful trials. This particular trial is also in the Midlands. This was a misty, rainy sort of a day. This has been grown on the standard system of 6 lines of plants, 4 dripper lines. This is about 1.2 hectares of stevia. Again, planted quite late in winter, so in a very cold part of winter. One of our coldest winters on record, and yet very good growth here. So this is a very exciting trial. It's a standardized trial for us. This is Pongola. Again, you can see it's quite a dry climate. You can see the hills in the background very dry, but they're fully irrigated. So very fertile soils and lots of available irrigation water. So good results there. This is after about 6 weeks of growth. You can see we're reaching sort of 26, 27 centimeters in growth and very nice, dense leaf formation. So variety is performing very well in Pongola. This was center pivot, not ideal for stevia growing, but this farmer had center pivot, wanted to try it there, and we thought it would be a good experiment to see how it works. So it's been fairly good, but not as good as the drip irrigation, and the quality remains to be tested. This is our trial site in Mpumalanga. This is existing drip irrigation for sugarcane being used. Again, incredible growth. You can see on the left, around 42 centimeters. At harvest time, it was about 50 centimeters tall, very dense and looking really good. This was interesting because it's grown on the traditional drip irrigation for sugarcane, so 2 lines of drip only, and the plant density here is very low. It's only about 50,000 stevia plants per hectare, and yet the yields have been exceptionally good. So very promising, but again, probably the best agricultural growing area in the country in terms of soil, climate, etc. This is another Pongola trial. This is actually Kurt Stock. So Kurt is running our trials. He's one of the 3 directors of Stevia and intimately involved as a farmer in working out what are the best way to grow stevia in South Africa. So Kurt runs an irrigation company as well. This here is a moisture probe with telemetry attached. So we're doing quite scientific trials here, measuring moisture, stressing the plants, trying different fertilizer regimes, and seeing what we can achieve. So again, very good results for us here. And across our trials, very, very limited flowering, if any. Now, this was quite interesting for us. We were concerned about frost in the Midlands, and this trial had very severe frost. It had what we call black frost. I don't know if the term is similar in India. So clear ice, very, very heavy frost. And after the frost event, this farmer thought that he had 100% mortality here. All of the main stems of the stevia plants delaminated after the frost, and they all looked dead. These are also very young plants. You can see they're quite small. They've died, quite small plants. And yet, what we actually found was we had about 40% survival. So this is where our trial was quite important, because this black weed mat, a local weed mat produced, and a grey mat was better than plastic sheeting. And we think that's because it kept the soil temperature a bit higher. But although 60% mortality seems quite catastrophic, we won't grow it in these areas regularly. It won't be a common growing area on the very frosted areas. But it was very interesting to see that despite extreme frost, this grower said it was the coldest winter in 17 years. We still had quite a high survival, which was quite pleasing to us, better than expected. This was also a frost-hit area, not as bad. So this was more of your white frost for 4 or 5 days. This farmer expected about a 25% survival of these plants. And in fact, he achieved much greater. In the end, around 90% of the plants survived. So given this was also a very severe frost event, very encouraging for us that the growth in the Midlands is better than expected, and that the frost tolerance of stevia is much greater than we expected. And so we're very pleased with those results. I just want to talk about the global market quickly. So obviously part of where we are now is we're not at the marketing stage yet, but it's important to know what the global market for stevia is. So we also got a very detailed report, again from an Indian source, and it showed some interesting information for us. Market size in terms of US dollars growing at 7.2%, and the volume growing at 6.5%, which does indicate that the prices are going up. Demand is greater than supply, and prices are increasing. It's obviously a very good trend if you're getting into this sort of market. Some more specifics, the US market growing at around 6%. This is estimates going forward, so anything from 4 to 8, but 6 to be expected. The European market around 7%, and the Asian market 8%. So clearly Asia is a growth area, and the potential is even greater. So this is encouraging for us to see a growth market. Sugar is growing at under 2% a year, and also has a negative sentiment. So this is a promising crop in terms of its market sentiment. People like natural. They like natural medicines now. They like natural sweeteners. And people are trying to go away from artificial and trying to go away from high glycemic index like sugar. So we think this is very positive for us overall. This is a market presence graph from that same chart, and I think most of us involved in stevia, certainly for sweeteners from a sweetener perspective as opposed to medicine, the Pure Circle are the world leaders. There's a few other companies, Tate, Lal, etc., which are a bit behind. We believe we are here, again, through our strong collaborations with India and Shantanu in particular and stevia technology, but with your history in India of growing stevia, we believe that our strategy is very strong. We also have very good commercial farmers. Our commercial farmers are large scale. They are high precision farmers. We're going more and more into precision farming here. And so, we're world class in terms of yields and in terms of our farming abilities. Our engineering, sugar in the sugar mills, etc., is also very good. So we think we have the technology, the technical expertise, and the collaborations that allow us to become a world leader. And that's certainly a goal, is to become a world leader and not just to become another commodity provider or a low-cost provider. We want to play in the top end of the market. This is also from that report. So 2018, you can see only China has all of the boxes ticked at that time. I believe India should have a few more circles there, but certainly in Africa, it was only Kenya and Zambia, which grows some stevia and exports dry leaf. We want to have the full range of manufacturing, processing, laboratories here in South Africa. We're in the process of setting up a laboratory, and as I said, establishing processing. And the farming is already looking very promising. So we would like to be a world leader in stevia. So I'll talk about formulations and marketing briefly. Again, so our focus has been on not selling stevia as a commodity, but selling it as a formulated product, sort of an end-user product. That's where the market is going. People want to buy bespoke products that meet their needs. So a lot of effort's going into how we formulate and market that. And again, our collaboration with international partners, and particularly India, is key there. We have no experience in this. We are growing the first stevia to be grown in South Africa. There has been some blending done here before, but mostly the stevia that's in the country, and it is widely available, is imported from elsewhere. We'd like to produce it locally and we'd like to collaborate that with other people. So the other thing that our marketing team has been looking at is the different market segments. So on the left here, you have the sort of lifestyle, health shop, organic packaging, sort of bring your own container, which is becoming quite big in South Africa. On the high end of the market, people are trying to become more and more sustainable, get away from packaging and plastic, etc. And then we also think there's a potential to target a younger youth market. When I was part of SA Cane Growers, and Kurt Stock is still involved in cane growers, we produced a cane juice. So also through collaboration in India and stuff we learned over there, we produced a sugarcane juice. The preservation was through pasteurization, so no preservatives. So a natural cane juice. We believe there's an opportunity to also produce a lower glycemic index juice. So reduce the sugar content maybe by half, reduce the bricks down to maybe 6, add stevia, and have a lower glycemic index energy drink that's natural, sugarcane and stevia based, but also targets that market where people want to have something healthy, something natural. So we think there's potential for that end of the market as well. Just in terms of ongoing collaboration, it's very exciting to be part of a conference like this. We were part of something similar a year ago, and there certainly is a lot of growth there. And we believe, obviously to date, it's probably been more than 3 years now. We've worked along with Shantanu and other Indian companies and collaborators, and we think there's a great synergy between Africa and India. I love the term frugal engineering, which Shantanu introduced me to. Now, we see India as being quite similar to Africa in some ways, very sophisticated in some ways, and in other ways, simple technology works for us. We built a biogas plant with European technology, and it's very, very complicated. I saw your simple frugal plants in India. That's better for Africa. We want simple engineering, simple technology that just works. It suits our climate better, and it suits our region better to have simple technology. So we've certainly learned that the collaboration between South Africa and India is key to us, and we think that ongoing it's going to be even more important that we collaborate together with like-minded individuals And like I say, my 2 trips have been invaluable, and we actually would not have started this project, and we certainly would not be as successful as we have been to date, and it is early days, without working very closely with India. So that's all from me for now. Once again, thanks very much for the opportunity. We are new. We don't have products yet, but we are going about this, we think, in a very professional way with a long-term view. And we look forward to more collaboration and more working together with companies in India and elsewhere into the future. Thanks very much.
Thank you. A very good evening, good afternoon. Actually, CEO Sahab is another meeting. I am Deputy Director, NMBB is sharing the session right now. So thank you, Research Sahab. You have given a very good information about the marketing of different medicinal plants, particularly on stevia for global marketing and its technology used for the marketing aspects. So it's very good information. Any questions, please? Other members.
Professor Ashish Majumdar.
Yeah, please.
I'd like to thank Mr. Richard for giving such a nice, idea about particularly the forecast that is going to happen we are expecting to happen in 2020 and 2030, so far the stevia market is concerned. And it's also very important to note that even in East Asia, we have a lot of, expectations so far. It's, the market demand is concerned. So stevia is becoming probably a very important, is going to play a very important role in our medicinal plant sector. And we are really looking forward. Here also we are doing some projects with, particularly with Mr. Shantanu Chakraborty and Janus Life Sciences on behalf of, obviously, National Medicinal Plant Board is supporting that. So thank you very, I think, Richard Harvest, and I am welcoming Dr. Murugeshwaran, our Deputy Director, National Medicinal Plant Board. And it's due to, inability of Dr. Shastri, he's being in a very important meeting of the ministry, suddenly called because he was almost ready. Even at 12:30, he has confirmed. I think this meeting, there might be some very, very emergency meeting has been called for which he has to leave. And I think now we will be able to, Dr. Murugeshwaran, will be chairing the session. But
I'm sharing the session. No issues. We will proceed further.
Dr. Murugeshwaran, I take this opportunity to introduce our next speaker, the eminent personality, Dr. C.K. Katia. So
actually, right now we right.
So just I am introducing him. Probably you do not have it readily available with you now. So let me do it because he is an eminent personality in the field of medicinal plant sector. Probably very well known to everybody in India and abroad. So Dr. Katia, I'm welcoming you very much here because I know personally very much, and he is a great supporter of medicinal plant sectors. Now, he was born on September 27, 1954, and Dr. Chandrakant Katia, is MD in Ayurveda and PhD in Pharmacology, Rasha Shastra from Institute of Medical Sciences, Banaras, Hindu University, Varanasi. This unique blend of Ayurvedic and modern medicine knowledge has helped him in interpreting Ayurvedic principles and practices in modern scientific language. For the last about 30 years, Dr. Katia has been in the helm of affairs at India's best research and development driven companies like Ranbaxy Laboratories Limited, Gurgaon, as Director, Herbal Drug Research, and Dabur India Limited as Head and Vice President of Dabur Research and Development Center, NCR, Delhi. Currently, Dr. Katia is Chief Executive Officer, Healthcare Technical of Imami Limited at Kolkata, India. During his tenure, Dr. Katia has developed several of top-selling Ayurvedic herbal, besides pharmaceutical products in the field of neurology and oncology. He has also made significant contributions in plants-based drug discovery. Dr. Katia, actually, there is a lot of things to say about him. just to particularly his reference to the ministry, I am telling you, he is a member of multiple important committees, including governing body of IBSD, of DBT, and All India Institute of Ayurveda of Ministry of Ayush, and Southeast Asia expert panel on dietary supplements for United States Pharmacopoeia. So Dr. Katia is a Vice President, Society for Ethnopharmacology, India, and also has been 2 terms President of Society for New Age Herbals. Dr. Katia is a hardcore researcher, academician, and expert in regulatory policies for traditional medicines, including Ayurveda. So this is, in a very nutshell, what Dr. C.K. Katia is, and I switch over to the session chair, Dr. Murugeswaran, please. You may request Dr. Katia to join, deliver his address.
It's very interesting, very nice introduction for Dr. Katia. It's good. Actually, the session, the topic, global market potential medicinal plants, the recent market trends. It's a very interesting one, and there are many medicinal plants which has got high value right now because of this COVID-19 pandemic. There are many medicinal plants like Tulsi or Ashwagandha and Gilo, all like that, and Kalme, all medicinal plants are getting very high demand in the industry and as well as in the national and global level. So I think Dr. C.K. Katia will give more information about the medicinal plants global market and the trend that right now, the demand and the requirement. So I request Dr. C.K. Katia to give your presentation. Sir, please.
Thank you very much, Professor Ashish Majumdar and Dr. Sastry and Dr. Murugeswaran from NMPB for giving the opportunity to share some of my views, and congratulations for having the international conference. I think the time is very apt to hold this kind of meeting because, as Dr. Murugeswaran said, that it's a high time, and India has shown that how to use herbs and Ayush products to protect its population from COVID-19. Recently, it has been vast evidences have been generated. Today, what we'll do, because we are talking of global scenario, so some of this information to global scenario, what I will do, I'll be sharing what are the top 40 selling medicinal plants in the world. Out of them, and especially in America, and out of them, how many are Indian plants? And there are some of the Indian plants which are available in other countries also, some of which are specific to India also. And I briefly narrate their benefits. Now this slide, I think almost everybody who is working in the field of biodiversity and medicinal plants knows that India is a hub of biodiversity and medicinal and aromatic plants, and it has we have a huge biodiversity. So 15 agro-climatic zones. I think it is second day, so most of you might already have been aware of it. And India is a home to coolest and the hottest both the climates. And yesterday you have seen very unfortunate thing happening, the glacier in Uttarakhand. That was one of the coolest areas. And with this come lot of other human problems also. And the good thing in India is that we have institutions ranging from Himalayas up to the plains everywhere. Agricultural universities, very good network is available for collaborative work in India. For today's presentation, what we have done is, we have selected top selling herbs, list of those herbs. How? We have taken the list from US, 3-year sales of herbs from 2 data sources published by Herbalgram from American Botanical Council. We also looked at physician desk reference for herbal medicines. Though it does not give the market research, it does not give about the volumes of sales, but it gives about the benefits of the products which are being used. Then we also screen, being member of the United States Pharmacopoeia Herbal Medicine Compendium. We also have looked at what kind of plants we are working there, total list of plants. And we also have consulted one of the latest books by Mr. C.P. Khare, World Healing Plant for Tomorrow. Besides, we also have consulted one more book. And basis that, we have arrived at this list. Look at the top selling herb is Nairobium vulgare, worth $63 million, single. Echinacea worth $39 million. Now, echinacea is for common cough and cold. Cranberry is $38 million. Now come three Indian plants: turmeric with 34, flaxseed with 24 million, and garcinia with $22 million potential. And then green tea. I don't say that green tea comes only from India. There are multiple sources, like from China also. And then Simpsifera simosis is a $20 million, followed by aloe vera and ginger. The ginger also comes from multiple countries, but Indian ginger from northeast is very, very special in terms of therapeutic benefits. Then comes valerian, both European and Indian, is worth $30 million. Milk thistle, to my surprise, I found that is one of the most effective products for liver care, but it was worth $13 million. Followed by ivy leaf, Serena repens, but if you look at Indian plants, fenugreek coming at $12 million, and garlic also $1 million. Next, coconut oil. It is a recent entry. It was not there 2 years ago. Coconut oil has entered, now it is selling worth $8 million. And senna worth $5 million, and boswellia we will share later when we discuss about the individual plants, about $5 million. It's upcoming. And then fennel, cannabis. If we forget cannabis right now, because cannabis mostly is being cultivated in US, this is not Indian cannabis, but it's cannabis, its origin in India anyway. So fennel, green coffee extract, and ashwagandha. These $3 million seeds. Ashwagandha also is the latest entry in the last 5 years. It has grown at tremendous speed. So these are out of the 40 plants, there are 16 plants which are from Indian origin. And look at their volumes. Aloe is 15,600 metric tons. Ashwagandha, 4,190 tons. And this is their Indian domestic consumption. This is not exports. It's Indian domestic consumption. Ginger, more than 2,000 tons. Turmeric, 1,300 tons. This is the consumption for medicinal purposes. But turmeric is a very common spice in India, so therefore its consumption actually might be multiple times more than this. Senna, about 1,000 tons. Boswellia, 650 tons. Fennel, and now the fennel, methi, and garlic. These three also are the spices. So there, and this is the use. This tonnage is only for the medicinal use, but non-medicinal use as a food, as a spice, as a multiple times more than this. Garcinia, I can say almost 90% of garcinia exported from India to US. So Indian, and if this is India, then you can say almost 3,000 tons, maybe not 3,000, sorry, almost 1,000 tons, maybe the total garcinia production, including exports. Then I'll see that flaxseed. Looking at these plants individually, if you look at curcuma longa, there's turmeric. Now everybody knows curcumin. I think this is if I may say so, I think after ginseng, curcumin is the most researched product, and most of the research has been conducted in US on curcumin, and you name the activity and this has the activity. However, it has its own problem. That's why it could not become a drug. It is still used as a dietary supplement. The problem was basically of the its absorption in the intestines, very low absorption. Fosler uses are too many. In the modern uses, some of the clinical trials which have been conducted, but Recently, during this COVID in India, its sale has gone up tremendously, and only because of its immunity enhancing property and its anti-allergic property, which was probably responsible for protecting from respiratory infections. And its total, its US sales is 34 million, only US I am talking. Look at the ginger office snail. Ginger office snail, one of the, it is also specific to India, but it has multiple varieties. But most therapeutically most effective ginger, it comes from northeast of India. And one of the uses is anti-cancer drug-induced vomiting, for which there is no treatment, or actually not, I will say, not very effective treatment. There, ginger works. And also in pregnancy-induced vomiting, also ginger is very good. Besides that, ginger also good as a digestion and for inflammation. Like in joint therapy, in Ayurveda it is said that when you have knee joint pain, just take ginger for 75 days. And taking ginger into the dose of 3 grams per day for 75 days, the need of the medication just get reduced by 50%, and intensity of pain also get reduced by 50%. So ginger is very useful. Then comes allium sativum. Most of the work on allium sativum has been done, I will say, on hypertension and heart-related things in Europe. Now, garlic also, when the chemicals have been conducted, it has been conducted on the powder, on the oil, and on the clove itself directly. And so many clinical trials have used so many different doses that it has become very difficult to identify a particular dose, particular drug, particular dosage form. But the fact remains that this is one of the most researched product, and being part of a spice, people are using it as a spice. Therefore, probably its medicinal properties are also coming while it's being used as a part of the vegetables, cooked vegetables, spicy. Aloe vera, everybody knows. multiple activities in India. In Ayurveda, it is very good for two purposes, basically for liver and for skin care, and also for topical products in skin care as a moisturizer. Piniculum is one of the best product for anti-flatulent and digestive. Some of the time what happens is its Ayurvedic uses something different, but when somebody conducts a clinical trial, they do something different. Like here, it has been tested for respiratory complaints, but Ayurveda does not recommend it for respiratory complaints. Ayurveda recommends it for flatters, for digestion. So it has its own space in the field of medicine. And this is flaxseed is one of the probably one of the few vegetarian sources of the omega-3 fatty acids, which is very good for heart. A lot of studies have been conducted on its usefulness for skin, but you see, somebody has also conducted a study on constipation. So it has multiple therapeutic benefits, and total sales in US is $24 million. Within somnifera, I was saying that this is one of the wonder drug, and it has all the potential of being sold throughout the world, higher volume than actually ginseng. And recently also in India, Withania somnifera was one of the first plant, the compound from which withanone had shown the activity directly on the SARS-CoV-2 virus. This was one of the first plants, Glycyrrhiza and Withania. These two are the first plants to report it for activity, and it has shown its usefulness during throughout this whole pandemic in India. And one of the, let me share with you, recently I saw an article that why the load in India is low, why mortality is low. People are shying away from accepting the fact that this low incidence, this low rate of mortality is because of the predominant use of Ayurvedic medicines, Indian systems of medicine being promoted by the Government of India, Ministry of Ayush, for Ayurvedic immunoboosters like Chyawanprash, like Withania somnifera, which is ashwagandha, like turmeric, and like giloy, like Tinospora cardifolia. So some of them have already entered US market and Europe market, but say for example Tinospora has not yet entered global market. So we need to do the special efforts for that. Boswellia, as on today, government, a company wants to develop a product for arthritis, for osteoarthritis. It is not possible to develop a product without having Boswellia serrata, be it topical product or be it oral capsule, whatever. But this has become the essential component. However, its market potential has not grown to its potential. It's only $5 million. I'm sure, but this is US market. In India, I think almost similar sales might be in India also. But as of today, this is one of the most effective product for osteoarthritis, and it has become essential component for most of the products for arthritis. I think this has a monopoly item. This is a monopoly item. So Sena is the monopoly item for constipation, one of the most effective product, and I think 90% Sena goes from India, and this is organically grown, mostly Rajasthan. And but the problem is that the kind of technology which should have gone into its cultivation has not gone into it. So what happens is you take first crop and you get almost 5% of senosides. But by the time you go on rotation, third crop comes, it goes down to 2.5% of senosides. Unfortunately, the global quality standards do not include senoside as the quality parameter. It is pharmacopoeia includes. Indian pharmacopoeia includes. But when it is exported, senoside as a marker compound is missing. So therefore, lot of research still needs to go into the cultivation and technology of Sena to maintain the senoside content at almost 5%. Today, it's close to 3.5% only. Garcinia, I think whenever we talk of anti-obesity products, anti-obesity ingredients, Garcinia always comes on top, be it US, be it Europe, anywhere. And it is, I think, most of the Garcinia exported from India. It's Indian origin product containing hydrocytric acid. However, too many clinical trials have not been conducted, and if conducted, 50% of them say the efficacy is good, 50% of say it has placebo effect. So there is no confirmation. But the fact remains that as on today, for obesity, Garcinia is #1 product. And actually, I know a company in Hyderabad which at one time was exporting 1,000 tons of Garcinia, 1,000 tons, and whole factory was dedicated to Garcinia, to US. This is Trigonella phenum gaseum. It was earlier known to be a digestive, to be a product good for say anti-inflammatory and other things. But for the past 6 to 8 years, it is also known for its very good efficacy on diabetes, lowering down the blood sugar. And currently, Indian Council of Medical Research is developing this Trigonella based product, fenugreek based product for pre-diabetes as a phytopharmaceutical, which probably may be one of the first phytopharmaceutical drug for a condition called pre-diabetes. Basis human clinical trials on almost 700 patients. The trial is going to start very soon as a phytopharmaceutical. So at the end, out of the 16 top Indian medicinal plants, nearly 5 are already being exported in large volumes But what about the rest? There are certain plants which are yet not there in the list, like Andrographis paniculata is not in the list. Like Brahmi has not yet achieved the status to come in the top 40, right? So Andrographis, Brahmi, Tinospora, Giloy, these are the three products which also should include here. And I think huge opportunities there. We need to put more efforts to increase the export volume, and considering our strengths of various different agroclimatic zones, we should consider domesticating some of the top selling plants of the world from US, from Europe, and bring them to India, cultivate them in India, and then again look at their business, look at their export. Like I say, why cannot India cultivate Silimarin, Silibum marianum? Why cannot we cultivate in India? So this can be another way of looking at enhancing the exports of the medicinal plants from India by domesticating some of the top selling products of the world in India. because of the various, because the benefit of multiple agroclimatic zones. And I would like to suggest that India should take up only 7 plants in mission mode. Only 7 plants in mission mode. Ashwagandha, Boswellia, Amla, Giloy, Brahmi, and now this one more plant, this Mucuna pruriens. Mucuna pruriens is one of the most important plant for multiple aspects, right from Parkinson's disease up to the mood elevator in today's world, when world is suffering from depression, very high incidence of depression. Mucuna pruriens stands very good chance. And this is in addition to the list of plants which already shared. And simultaneously, we need to focus on the quality planting material, as I was discussing about the SENA. So cultivation protocols need to be validated. Value addition and capacity building should be done at primary level. And National Medicinal Plants Board, I know Dr. Sastry, very good friend of mine. They are now, I think, making a plan, huge plan in India for creation, value addition at the local level and capacity building at the primary level. So primary processing should be done at the place of cultivation, and there is some kind of value addition. I think that will take India forward, and medicinal plants comes to India very, very naturally. Like traditional medicine, like Ayurveda, is inbuilt in our homes. We are born with that. Our mothers knew in which kind of dal to add turmeric, and in which kind of dal to add asafoetida, hing. Now she does not add hing to her hair ki dal. She adds only in the moong ki dal. So our mothers also were experts in Ayurveda, and so there are lot of wisdom, lot of unknown heroes still available which are not yet been explored. So let us look at and one more thing. What is good for Indians, it's good for the people living outside India also. Good for the globe. That's why we always call Vasudhaiva Kutumbakam. What's good for me, it's good for you also. So let us convert this into a huge business opportunity. And with this, I am very thankful to National Medicinal Plants Board and to Jadavpur University, especially Professor Ashish Majumdar, for giving me an opportunity. And if there are any questions, I'll be happy to reply.
Yeah, it is thank you, sir. Thank you very much for your wonderful lecture and informative talk, particularly on the top listed medicinal plant and their demand and requirement in national and global level. But it is very interesting, like Euthania, Somnivora, Boswellia serrata, Cassia, Angustifolia, and Garcinia. You have given very good information about many of the medicinal plants, the top listed medicinal plant. So I think it will be very useful to the farmers and the cultivators and those who are working on the medicinal plant sectors. So it is thank you very much for this wonderful informative talk. So if any questions, please, other participants, you can come forward, any 1 or 2 questions. So Katira Saab is ready to give answer now.
I have a small question. Particularly, I know.
Any questions? Otherwise, we'll. Yeah.
I have a small question.
Yeah,
Sir,
please.
I have a small question. Actually, not a question. Rather, I'd like to have some guidance from Dr. Katia as well as the other panelists present, particularly the Richard, Mr. Richard. So it's basically my question is that so for the farmers' livelihood of India is concerned, what sort of obviously it depends upon the particular scenario of particular agroclimatic conditions, but whatever other species which we can very easily get a good market with not much processing at the field level, particularly at the farmer level. If you can give certain ideas, we can promote that for the people for the farmers in particular.
May I?
Yeah.
So Amla is simplest. Amla is simplest. Let me share with you a success story of National Medicinal Plant Board. Dr. Sastry is aware. Dr. Murgeshwaran may not be aware that in the Madhya Pradesh, there was the forest of Madhya Pradesh, there was a village of only 25 families. Their total income was 2,500 rupees a month. So 30,000 rupees a month. What Medicinal Plant Board, through a project given to given to Forest Department of Madhya Pradesh, we gave 100 plants of Amla to each family. And we told them to maintain those plants at and whatever required to do their own. So those 100 plants were maintained by those families, with one family, 100 plants, right? For 3 years. After that, whatever Amla is grown, that Forest Department will purchase from you and sell it in the market. Can you believe? After 3 years, from 30,000, their income grew to 3 lakh rupees. Right? So Amla is one simple thing which goes everywhere. But to my personal opinion, if you ask, if you want to increase the income of the farmer, it should be the aromatic plants rather than the medicinal plants. Because if you increase the cost of medicinal plants, then the cost of medicine also goes up. And the same poor person will not be able to afford that medicine.
Okay.
So I think if you want to increase the income, go for aromatic plants, right? If you want to make the product available, medicine available, then please do not include medicinal plants in the scheme of doubling the income. It's a double whammy.
Yeah. Now the thing is that we need to particularly we need to develop the thing in such a way so that we can do certain things for the aromatic plants also. But as you know, NMPB, Dr. Murugeshan is there.
Yeah. Yes, please. Actually, where NMPB is focusing on the cultivation of medicinal plants across the country. Our CEO, Sastry Sahab has taken very good efforts to give the guidance and all. Our national SMPB and RCFC also there. We are interacting with the coordinating with the farmers of all over the country to promote the cultivation of medicinal plants in different regions.
Yeah.
So for technical aspects as well as marketing aspects, we are giving guidance, and also for QPM, we have tie-up with the ICR institutes and CSIR institutes for producing the quality planting material for cultivation purpose. So apart from that, we have the marketing side also. We have tie-up with the industries with the buyback agreement of raw materials. So all those things we are initiated, and I hope that in the future, coming months, coming years, farmers definitely will get benefit out of the cultivation of medicinal plant through the National Medicinal Plant Board. I am very much sure about it. I am also confident about this. Please, sir. Thank you.
Thank you.
Thank you, Dr. Katia. With your kind permission, Dr. Murugeswaran, I would like to invite our next speaker, Dr. Kumar Basu. He is our next speaker. Let me introduce him. Mr. Kumar Basu did his 2 masters in botany specialization in microbiology from the University of Calcutta, and agricultural studies from the University of Lethbridge, Canada. Currently serving as the Executive Research Director, Performance Seed, Lethbridge, Alberta, Canada. He has several peer-reviewed articles and book chapters published in reputed national and international journals. He has written, edited, co-edited over 25 books. He has participated in a number of national and international seminars and conferences, presenting papers and posters, and is an active member of a number of organizations in Canada and India. He is associated as an editor and contributor to the Encyclopedia of Earth, specializing in areas of biological and environmental sciences, traditionally trained in botany and specializing in microbiology, works actively in various areas of plants, sciences and environmental conservation. The author works extensively on forage crops like forage legumes and grasses, medicinal herbs and spice crops like fenugreek. Yesterday we had a lot of discussion on fenugreek as well. Currently he is also working in areas of pollinator insect conservation, integrated habitat development, and on establishing pollinator sanctuaries in various agroclimatic regions. Shoikat received the Graduate Citizenship Award 2009 Alberta Graduate Student Award 2009, CSA Best Article Award 2010, SAEA Volunteer Award 2011, AFC Celebrate Agriculture in Alberta Photo Award, and ASPB Peggy Thompson Publication Award 2014. Gopal Chandra Bhattacharya Award, Annual Award 2020 GBMC, and Professor GB Matthew Award CMRA. So with this, I request Dr. Murugeshwaran to please invite Mr. Soikat Kumar Basu to deliver his address. Dr. Murugeshwaran, please.
Yes, please. So I hope that he will also come with some good information about the marketing and other aspects of the medicinal plants regarding of the business and national and global level. So I hope that he will give more information on this regard. Please, sir, please come. Please give your presentation.
Thank you very much. It is a pleasure to be here at this August occasion, and I thank the organizer, the Ayush Ministry, and the Jadavpur University for inviting me and providing this platform to share my views. I won't be using any PowerPoint slides. I'll rather use this platform and an opportunity for a direct communication. Thank you and welcome to everyone. My sincere gratitude to all the speakers, participants, and the organizers. I come from Canada. I was raised in Calcutta and I work and live in Canada. I am now visiting India to see my parents, and it was an opportunity therefore to bang on to your conference. I would like to thank the government of India for establishing the Ayush Ministry. I think it's an outstanding, innovative idea and a door opener for a huge industrial development in the coming years. Nonetheless, to start, I would like to suggest that, this year or the past year has been devastating for the entire world. The COVID-19 pandemic has economically crippled many developing countries, including developed countries like United States, Canada, and European Union in several ways. And there has been so much sad loss of lives and livelihood, unemployment across the world. However, if there is one silver lining that came up with the COVID-19 pandemic globally, has been this fact that the use of medicinal plants or Ayurveda or traditional medicinal practices has come up to the entire world in absence of any applicable synthetic drugs available for restricting and controlling COVID-19. I think this is a gateway and a grand opportunity for a country or like a biodiverse country or like India, which has a huge plethora of medicinal plants, and it opens up a massive business opportunities. Last but not the least, I would like to share how we operate and where we look for collaboration with India is in the fact that say, for example, I am predominantly a forage producing company, but we do a lot of medicinal plants, as there is a huge demand for quality medicinal plant products and medicinal plant crude extracts in Western countries, including United States and Canada. Now, particularly with respect to Canada, it's a huge, massive, the world's second largest country with very little population, close to around 30 to 35 million people, but it has huge agricultural industry. One of the challenges in Canada, in particularly in agriculture, is the short growing season. We have only 100 frost-free days to produce our crops. But the extensive agricultural system in Canada is such, and the fields are so vast, varying between 5 to 50,000 or 60,000 acres of land under one farmer, that you can produce extensively. One of the challenges, particularly with respect to medicinal plants that we have faced, and it's our personal experience and my personal experience too, it's not easy to grow medicinal plants across outside South Asia, particularly plants from India, Pakistan, China. What we have to do is, like, we get requests, we get seeds, you have to acclimatize those, you get phytosanitary certificates, you need to grow them, you have to grow them in various environments. And finally, what we were finding is even the top certified species or top certified cultivars from India, Pakistan, and other countries, when you are growing them across United States and Canada, we are finding that in several instances, these high-yielding varieties are actually producing very, very low amount of all those important chemical compounds, which could be, sapogenins, glycosides, glucosinolates, essential amino acids, complex carbohydrates like galactomannan. We find it hard to grow there. Our years of experience has shown that plants usually respond to a genotype into environment interaction. So a plant which is a high producing in India or China does not really produce the same seed when you are grown in a different environment like Canada and United States. They usually do not perform very well. So you need to go through a long cycle of breeding where you make selections of the top varieties, look into their chemical constituents, ability to withstand the natural environment, other arbitrary agricultural parameters, grow them in multi-location, and then you may come up with one or two varieties that are well-performing and that suits to the needs of the pharmaceutical, nutraceutical, and the functional food industries in the Western countries. Now, this is a very cost-enduring process for many Western countries like Canada. We could not afford too many years of experimentation of growing such medicinal plants. For example, I'll give you an example. Andrographis paniculata, a herbaceous plant from the Acanthaceae family, is an annual herb, excellent medicinal properties, called kalmeg and green chirata. We found it very difficult to grow that in Canada and in various parts of United States because it would simply not produce the same quality of chemicals that you would see them growing in India. So these agroclimatic variations take such a long time in the breeding process to come up with an essential cultivar that can deliver at the industrial platform, makes it very difficult for us sometimes to grow them. And all the pharmaceutical companies, Western companies, highlighting mostly on nutraceuticals and functional food industries, do not want to spend that much money or 5 or 7 years of experiment, research, and then coming up and screening out those cultivars. Yet, we do a lot of screening of hundreds and thousands of medicinal plants across the world to see which one of particular one is functioning for a particular control of a particular disease or a particular kind of an ailment. So in that particular way, what the countries want to do, like USA and Canada, it is easier for these countries to buy bulk products from India at a much reasonable rate and get a high quality product that could be processed here in Canada. And then you get those crude extracts and then sell them to the pharmaceutical, nutraceutical, or functional food companies. For example, I'll give you one more example of a functional food industry. Say, for example, a bread package of 10 or 12 slices of bread costs $5 to $6. A functional food industry wants to enrich the medicinal quality of that bread that someone is eating. And it's like organic food production. So they will mix another 10, 20 different types of seeds. Some of them are cereals, some of them are medicinal plants, which are certified by the Agriculture and Agri-Food Canada or the USDA, United States Department of Agriculture, that it is edible, could be integrated into human food system. And then this same bread slices, which was $6, become $15 to $20 in the open market. and the companies make enormous profit because there are buyers, there are customers who are interested in having value-added product. They will rather go for a nutraceutical bread paying $20 at this stage and point of economy rather than a $5 flat bread because it's nutraceutically enriched. Same for the nutraceutical industries where they look for a wide range of phytochemicals, starting from glucosinolates to whatnot, to flavonoid, isoflavonoid, isoprenoids. But as I told you, medicinal plants are not grown very commercially. The medicinal plants across the world that are available to most of these industries actually are already crops. For example, we use a lot of chemicals from the spice crops, aromatic crops, for extracting of essential oil, flavor oils, aromatic oils, or they are used in spice. But they also have a huge amount of medicinal properties. Many drugs are developed from that. But these are already recognized crops, and they have been used for decades. But when you're looking for introducing a new crop like Andrographis paniculata, which has huge medicinal property, it becomes extremely difficult to grow them. And it takes a long time to grade an essential cultivar that can deliver at the industrial level. But while this opens up a huge opportunity for a country like India with huge stock of medicinal plants, it's a challenge for exporters, particularly from the United States, Canada, and others. And this is an example we have shared, is the complexity of getting these resources. First of all, there is, like whenever a new company is looking for a particular ingredient, they reach the Ministry of Trade or Commerce or Culture, and they are moving around like from one window to another without getting any direction. I'll share one personal example, and we have several. It's several years back, we were trying to get some information from the Botanical Survey of India. We tried reaching the highest level of Botanical Survey of India, the primary, secondary, tertiary, quaternary, all kinds of level. We never got any information, never an acknowledgement of an email, fax, WhatsApp, whatever we have tried. Now, this creates a frustration because this is a day of online digital platform. If you do not get a communication or people do not direct you whom to contact, the next stop is, as usual, is China. Because China's international markets makes it very easy for international exporters to get materials from them. You can set up online discussion, get your contract signed. The red tapeism, particularly now in India, still holds back extensively in this trade and commerce aspect. Now, I was lucky enough once to be with the High Commission in Toronto, the High Commission of India in Toronto, and there they suggested that why don't you approach the Honorable Prime Minister Modi's portal called Right to the Prime Minister, where he requested this information. And to our amazement, we received this information package from the Botanical Survey of India by a speed post within 2 weeks of filing a request and a complaint. Now, I am not here to make a complaint, or I'm not here like giggling for asking for pointing fingers at various institutions. We have the same kind of experience with various premier institutes across India from science and technology background, including the premier IITs, where you just do not get a line of communication. People are not directing you to the person that you need to contact or communicate, and then the country loses an opportunity, right? I request the Ministry of Ayush to take this as applied from exporters from the Western countries to make this process easier. An officer holding a highest position has a responsibility towards his job, and he's bound to respond or answer. I believe that a single executive director or a director general is not the only person holding that office. There are several secretaries and assistants to them. But it is to our astonishment to this day of digital platform that you do not get a simple communication to reach various people, key resource people when you are in need. Vis-a-vis, if you place this as an example of our collaboration with a private company, we usually get very good response from that. But sometimes you cannot get things done just by tying up with a private company in India. You need to knock doors of the universities. You need to knock doors for technology transfer. You need to get a contract signed. And then comes the long process of contract signature, which goes through so many loops and so many offices that you lose interest. And your next best stop is China, because you can get that done in 3 days or a month. India being an English-speaking country makes it so easier for us to communicate and get things done. One of the biggest challenges in China is communication, because they do not understand English. But in spite of using translator to communicate, we have been way more successful in getting responses, resources from China. And this is not just my experience. This has been an experience from various other countries. It is easier to do trade with Indonesia. It is easier to do trade with Sri Lanka, Bangladesh, even Nepal, compared to India, because of this attitude of being incognito in your office. I hereby request the Ministry of Ayush that this is a grand opportunity of medicinal plant commercialization, particularly for pharmaceutical, nutraceutical, and functional food industries across the Western world. I'm not just talking about Canada. By making this process easier, we need a line of communication. We talk about four pillars of trade and commerce in the modern time. And this is cooperation, coordination, collaboration, and communication, the 4 C's of modern trade and industry. And if India is holding back in getting those big transition, in spite of being a master and a colossal giant in the field of information technology, is this lack of communication. This is a case of attitude, I feel, and I think that this needs to change. It cannot be done overnight, I understand that, but the government of India and the Ministry of Ayush needs to facilitate this so that it becomes easier for exporters to reach the key resource people in India for setting up business collaborations, for setting up scientific tie-ups. There are several companies who would even sponsor Indian students to come and do PhDs and other higher studies if you get a response. A vast amount of time, it may be shocking to reveal, you do not get any response, whether it's phone call, whether it's email. And the other thing that we receive is whenever a government official finally replies, is through us like a snail mail. It comes via speed post, but you really do not need to spend taxpayers' money by sending the same letter. You can just email it to us. It saves the day, it saves the time, and it saves the process of making important decisions that could be done over the table within a very short time. Please do not take this as a criticism. I love India as much as you, and I want to see India as a global competitor of China in this. But India itself is holding itself back by not allowing this unique platform to open up and make trade and commerce easier. The other thing that is most important to do is about the quality control. Many times, as we have ordered materials on and from India, you will find there is adulteration or there is quality deterioration during the process of transport. I understand that India still needs to work towards, preservation, packaging of materials, because you will get, mold growth or moist materials being transported, and then the shipment is cancelled. It's a loss for the company. There are also challenges with respect to honey. Like honey becomes like Indian honey, particularly the Sundarban honey, is highly valued across the Western world. It's called the gold bar of trade and commerce, particularly in the honey industry, apiculture industry. The high prices that many companies pay, they do not get the quality material. China has been shipping adulterated sugar-coated honey in huge amount, and hence they have suffered a huge setback in their apiculture industry. It's just because of the fact that there is too much adulteration. It's sugar syrup being mixed with honey, 50-50, and being sold. Now, when a small company in India or a big company in India does that, it does not impact that particular company. It does not impact that particular university. What it impacts the brand India. A Western company, when it processes and pays the money and gets a substandard material, either through the process of deterioration that has gone through during the process of transportation, or during the process of harvest, or during the process of storage, it causes them huge economic losses. Even by canceling the shipment, the amount of time that is being lost from the material being ordered and the material being received and then being canceled is also, like, even if you get the money back, the amount of credibility that this company has to pay to its customer in Canada or US is huge. What happens is that next time they will not be utilizing the same resource, the same window, the same company to buy anymore their products. So I request the Ayush Ministry and the quality control operation system in India to please pay attention to this, because this is the way we lose or India lose huge amount of business opportunity to other countries. China has suffered significantly because of this. There has been a bad reputation because they have been sending substandard material. The quality control system in any Western countries, whether it's Canada, whether European Union or United States, is very high. And these analyses could be done at a very short time. And if they find by doing random sampling that the quality is substantial, then it's a loss. It's not a win-win situation for Canada. It's not a win-win situation for India. But I do see that there is huge opportunity in India. Like you have all the resource personnel, you have all the technologies available, and it does not cost that much in this modern day and time to maintain this quality control. Of course, the harvesting system needs to be changed or upgraded, or there may be a gap between how this is being done. I feel that the Ministry of Agriculture and other related trade and commerce industry needs to form an integrated platform where there is talks between Ayush and other these ministries that will help and facilitate the quality control aspect, the harvesting process, the storage process, and then their shipping to the other industries. And Ayush could be the platform for the trade and commerce boom that is coming up. India has a huge name for medicinal plants across the Western world. There are several people, before even the pandemic hit, would like to visit Southern India for Ayurvedic treatments, for collecting Ayurvedic medications, because it's cheaper and it's high quality. Many times, several patients who have been turned down from many unique hospitals or specialized hospitals in the United States and Canada could find their treatment back in Ayurvedic treatment in India. So it has become a boom towards the medical tourism in Southern India. Particularly, I'm aware of Kerala, that has been doing very good. So same is with the process of shipping of medicinal plant production. India has the agroclimatic zones. India has the manpower. It's cheaper to produce these plants here. All we want to do is them buy a high quality product from India so that we can profit and India can profit at the same time. We also understand through ground surveys that sometimes these plants that we buy or this honey that we collect from across the various companies, the farmers, the producers at the lowest and the lowest end are the least receivers. They possibly do not get these big prices that is being paid to various companies because these go through various middlemen. I would request the government of India to take care of this so that the process makes it easier, so that the farmers could benefit. It would regenerate employment in the rural sector in India. It will help in stabilizing the economy of India. And it will, by producing and providing quality products to the Western world, it will open up medical tourism. It will open up Ayurvedic tourism. It will open up research collaboration. And the other thing that needs to be developed in India is communication. With this, I would not stretch my lecture for a very long time. I once again thank Prime Minister Modi and the government of India and the Ayush Ministry for giving us this opportunity to share our views and our concerns and to highlight what are the challenges and opportunities for the government of India and Indian companies in trading with the Western countries, and what are the obstacles, what are the challenges, and what we need to do. I do sincerely believe, like a country like India, which is budding with talents, with such a young genetic pool of talents working at various institutes, these gaps could be very much easily eliminated, and India could become a primary medicinal plant supplier for the entire world, just like the IT hub has done for India. China has been providing diosgenin at the cheapest rate to the Western countries, and it has like natural diosgenin from Dioscorea, and it has become one of the largest leading producer of diosgenin in the world. Fenugreek or methi is also produces natural diosgenin and is one of the best quality, much better than what is available from China. These messages are the ministry needs to investigate in various countries and to understand which plants you need to put emphasis on, which are the plants, which are the products, which are the phytochemicals that Western companies, Western countries are looking for, and if they can cater down and provide those processed chemicals or the crude plant material for that, it would be a win-win situation, not only for India, but for the countries which will benefit. Ayurveda has been a gift of India to the entire world. I request Prime Minister Modi, through the Ministry of Ayush, to advocate to the United States to establish and ask for a day of International Day of Ayurveda, because this is a part of life. Not only for India, it is India's gift to the rest of the world. This needs to be recognized with this establishment of the Ayush ministry. I think the government of India has taken a broad step forward. I would request further so that we can look forward for more functional cooperation, coordination, communication, and collaboration between us in the long term. With this, I extend my sincere thanks to all. We'll be happy to answer any question if you have. Thank you very much.
Yeah, thank you very much, sir. Second Basu sir, we have given more information about different areas, particularly on functional food industries and organic food products. Other than that, medicinal and aromatic plants activities, and you have given more information. Actually, you have rightly pointed out that line of communication, medicinal plant commercialization is very much needed. Yes, we are also working on that, and our CEO is very much focusing on this. And actually, I can say that farmers to industry, that is our focus. Medicinal plants to how they are cultivating and with modern technical, adapting modern technology, and it goes to the ice industry. And particularly, we are concentrating on high volume and high valuable species in different regions for the temperate higher altitudes and also for the tropical regions. So this is a wonderful lecture you have given, and it is very useful to many of the medicinal plant related activities and farmers and other activities researchers. I hope that it is a very useful lecture for us. And now this is section over to our.
Thank you very much.
Assis Muzamdar to go for another lecture. He will call you for another presentation.
Thank you.
Thank you. If any questions, please come over. He's ready to ask.
I have a question already. I raised a hand. So now, if there is any other question, let it be addressed, then I will speak. If there is any other question from anyone else, okay, then let me put my question. First of all, I would like to thank Mr. Saikat Kumar Basu for giving a very wonderful, I should not say only a lecture, but quite an inspiring thing. So for the benefits for our farmers, which I am looking for, First of all, I would like to take this opportunity to welcome to our regional facilitation center of National Medicinal Plant Board at Jalpa University. And I am the nodal coordinator. We have Dr. Sanjay Bala as the regional director, Dr. Shomojit Bishwas as deputy director, and we have also Mr. Sudipto Ghosh as our consultant marketing. So we all are here, and we are really very happy to listen your encouraging lecture. And you see, our government of India is really trying to, bring the benefits, maximum benefits to the farmers. And for doing that, obviously, not only the middleman, but very importantly, that, whatever the certification, whatever the quality that is needed, particularly suppose your company or the, companies in the Canadian aspect, what are the demands for you? Like we came to understand, like Suecia Chiroeta, or you can go for like, this you have already mentioned. Calmeg is there. So whatever, these two you have already mentioned, and that's why I'd like to tell you that yes, we have even in our eastern region, there are Sikkim, there are even Himalayan range in our West Bengal. So there are plenty of this very, very useful, and very high quality Suecia Chiroeta and Calmeg is there. So how we can make these collaborations, I want a very definite way of going there. Do something for our country, for our motherland. So as we are all inspired by our, Prime Minister's initiative in the different sectors and converging the different areas of agriculture as well as the, the industry and commerce. We seek your help also. Please come and visit our regional center at the first opportunity. So this is my invitation to you. And now I think if there is no other question, with the permission of the chair, let me introduce our next speaker, who is Mr. Saurabh Sharma, Manager Marketing and Trade, National Medicinal Plant Board, Ministry of Ayush, Government of India. Now, let me read out his biodata. He is a B Pharma graduate of Delhi University. He is an MBA from IBS Hyderabad with 11 years of varied experience in sales, management, marketing management, business strategy, international trade in pharmaceutical industry. So we will be now, now I request Dr. Murugeswaran as a chair, you please take request Mr. Saurabh Sharma to kindly deliver his address. So Dr. Murugeswaran, please.
Yeah. Please, thank you. Dr. Sarvasarma is my colleague, and he's the very young and energetic officer of the NMBB. He's the person linking farmers and industry and stakeholders. I hope that we will have more information about the marketing aspects, particularly in the farmers to industry. So I hope that he will give more information for the marketing and other activities for medicinal plants. Sarvasarma, please present your lecture, please.
Okay, first of all, I would like to propose a thanks to RCFC Eastern Region for organizing international conference on medicinal plants and giving me this opportunity to present my views on the topic of global market potential of medicinal plants and recent market trends, and share the stage with few of the eminent speakers which are known globally. So I have prepared a brief presentation which is of 9 to 10 slides, and I'll just start with it. So as all of us are aware that during the COVID-19 times, medicinal plant sector has come up really well. An increase in the volume of trade in herbal products globally, driven by COVID-19 prescriptions and in herbal formulations exported globally, is known to have taken place. In China, where the first COVID-19 cases were registered, plants comprise around 80% of traditional Chinese medicine products. Out of the most official TCM formulas which are recommended for COVID-19 treatment in China, utilize close to 125 plant species. Majorly Glycyrrhiza glabra, ginseng roots, and Equilaria sinensis are used in traditional Chinese medicine. Advisories were released by Indian government for improving the immunity during COVID times. Ministry of Ayush has issued an advisory on Ayurveda's immunity boosting measures for self-care during COVID-19 crisis, which includes recommendations to take Chyawanprash formula, which contains a range of medicinal plant ingredients daily, as well as Ayush Kwarth, which is basically a mixture comprising of various medicinal plants like tulsi, dalchini, ginger, etc. Across the world, it is anticipated that the number of harvesters may increase as an impact of the long-term economic crisis due to COVID-19, in particular in areas where wild harvesting correlates with high unemployment and poverty rates. So coming to the economic value and volume of trade which is happening globally, the value of the global trade in medicinal and aromatic plant species has almost tripled in recent years, from USD 1.3 billion in 1998 to USD 3.3 billion in 2018. So this is based on the latest available UN Comtrade data. So this is an underestimate as a customs code from which the figure is derived, that is HS code 1211, does not cover all relevant plants traded. Estimates of the scale of trade are dependent on custom codes, which presents challenges given the variety of species involved and how they are captured in national reporting. And if we see the share of India in the global trade, it comes out to be very less, somewhere around 10%. But the good thing is that we are growing year on year basis, and we are net exporters of medicinal plants. And if we see the global annual income, which is generated out of non-wood forest products, it comes out to be 88 billion. And the good thing out of this is, out of the production of plant-based non-wood forest produce, it is valued at 77 billion. Now coming to the major exporters and importers of medicinal plants. So the world's top exporters are China, India, Germany, US and Hong Kong. While USA, Hong Kong, Germany and Japan are the top importers as well. So all these data is based on the value of traded products and using combined trade data of 1998, 2008 and 2018. So coming to the traditional medicine strategy, 2020 to 2030, I got hold of this very nice article wherein it clearly reflects the segments with the highest CAGR includes the medicinal tea segment, which is expected to grow 3 times in a size, and the health supplements sector, which is expected to grow at a 2.3x times. Many common consumer products and remedies, food drinks, cosmetics, and supplements contain plants with medicinal uses. A state of the world's wilderness, even from the Danube-Caspian region and the green heart of Europe, might actually be sitting in a tea bag in your cupboard or inside the health supplements in your kitchen. Although commercial wild collection is declining as populations move to urban areas, but it remains an important source of income in certain regions, especially for some communities and ethnic minorities. With certified collection sites in Bulgaria, Hungary, Poland, and Serbia, and other European regions, there are now a wide variety of certified ingredients which are available in the market. Coming to the species, threats, and wild harvesting, out of approximately 390,000 plant species distributed around the world, 60,000 plant species are estimated to be used globally for their medicinal uses, out of which 26,000 have well-documented use. If we see the number of species which are traded internationally, so roughly 10%, that is 3,000 species are traded internationally, and 11% of these species have been assessed are threatened with extinction in the wild based on IUCN red listed criteria. So that's a global perspective of the species which are used. Now coming to the India perspective, so we have conducted a study in year 2014-2015 by the name of Ved and Guraya, and as per that study, in 2,400 medicinal plant species are used in different systems of Indian medicine, with Ayurveda using 1587 species, Siddha using 1128 species, followed by Unani, wherein 503 species are used, and then 468 in homeopathy and other systems. If we see the global trend, so 60 to 90% of medicinal plants which are used today, they are collected from wild sources, and they are basically collected by the marginalized communities or the rural people. And if we see the Indian perspective of it, so out of 1178 species traded, these are the traded species, out of which 242 medicinal plant species are in high demand, which is 100 metric ton per year. We can clearly see that 72% of these species are sourced from wild collection, with only 22% of these species getting from the cultivation. So, because the trade of medicinal plants is regulated through CITES listed species, and that's the only enforcement body which is there. So there are 800 species of medicinal and aromatic plants which are listed in CITES Appendix 2, regulating the volume and nature of the trade. If we see the trade data for 2006 to 2015, 25,000 tons of CITES listed wild plant species were traded legally. And if we see the data which is available for the seizures which were made in 2018, which were reported by the EU member states, 260,000 plant-derived medicinal plant items were seized over there, which is around 23% of the total trade. So now coming to the way forward, but before that I would like to highlight one thing. There are challenges around trade in medicinal plant ingredients, which include increasing demand, complex trade chains, and traceability issues. Millions of wild harvesters in poor and marginalized regions around the world are reliant on this trade, which often operates under complex legality, with much more of the trade being informal and underreported. There are also identification issues, as plants are mostly traded as parts, derivatives, and finished products, including in mixed and processed form. Conversely, if we can work upon market awareness of sustainability issues, which is growing, and best practices are available, such as certifications, as well as some policy and legislative frameworks, notably including CITES regulations, creating opportunities for establishing the conditions for sustainable and legal trade in medicinal plants, benefiting livelihoods, ecosystems, and other species, as well as providing healthcare opportunities and food security. A combination of full traceability compliance with existing regulation, for example, species listed in CITES appendices, increasing the value to producers, and credible certification schemes are important elements of creating conditions for an all-encompassing win-win situation. That's a brief presentation from my side, and I thank everyone and especially the team from RCFC Eastern Region for giving me this opportunity. Thanks.
Thank you, Saurabhji. You have given wonderful information about the medicinal plant status and its marketing aspects. As far as the status are concerned, there are many medicinal plants have restricted their distribution because of, yes, you are rightly said that habitat destruction is there and wild collection is 72% is wild collection. Many of the products coming from the wild source. Cultivation is very poor. So what happened in the future, it is very difficult to maintain the conservation because most of the species, particularly in the southern region and the higher altitude region also, the species restricted to, in some isolated to some regions because it is due to the, yesterday we have a talk on this RCFC Himalaya, HP. So they also said that conservation is very much needed. Loss of genetic diversity and habitat destruction and some of the other activities are very much disturb the medicinal plant, and it is under very much threat. It is very much needed for conservation aspects as per my concern. So this is a very good lecture. Thank you very much. For any questions, please, other participants can come over there for questions. Now it's over to Asim Muzamdar, please.
Thank you very much, first of all, for all the speakers. We came to understand really many more important aspects of particularly the business opportunities as well as the collaboration with the foreign collaborators. So I think this session will be really a good session for all of us. And I really appreciate that particularly the way particularly the objective of our government of India to reach to the farmer through the medicinal plant cultivations, conservation, as well as what we now feel since we are doing in the field now. What I find with the problem with the FPOs, that is the farmer producers organizations here, they need some sort of post-harvesting treatments, which is very important. Most importantly, they need some sort of testing at the field itself, which helps them to get the idea really how much they are fulfilling the expectations of the next next taker. So that's very, very important. And I think our CEO Dr. Shastri has given a very nice idea that might be we are thinking the NMPD is thinking that to take the mobile testing setup to the field itself, so that we can get some sort of a very simple sort of certifications, like sometimes they need some very very simple indicators also, like sometimes they do not have any idea what is the moisture content after the drying. They do not have the idea, even you forget about the active components, even whether the presence of any sort of pesticides or any sort of insecticides or not. These are the very simple way we have to see, and how much is the the dried material there. So these are the very important issues which I understand if we can give that support to them, it will be very helpful. But at the same time, my expectations that from the industry is that there is an opportunity, and Government of India is now giving a lot of emphasis on skill development also. So what we can do is that we can go for developing the skill of the farmers as well. Those who are going for the medicinal plant cultivation, they should be trained in developing the quality planting materials that is we have developed certain materials for, and we have also already provided some trainings for good agricultural practice. What is even the good nursery techniques, what that they need to develop for good quality planting material. And this is really paved the way, I think, what our government of India is hoping for, or rather is trying hard to bring the benefits to our farmers for their livelihood, for their better earning, and for the betterment of our rural society. So I think this is the overall. We have taken the different deliverables from the different deliverables, and I hope if there is some sort of collaboration already. I know Ustivia is doing here, and we are some of the companies here are collaborating. Mr. Harris has come already once in our university, and we have organized one sort of program there also. So we are looking forward how much we can develop our medicinal plant sector and give the better livelihood to our farmers. So with this, and I'm requesting Mr. Kumar Basu, if you are there, please come, please pay a visit to our regional facilitation center at Day2 University. And rest, I'm requesting Dr. Murugeshwaran, our Deputy Director of NMPB, to kindly give your concluding remarks and give the. Katia sir is there, I hope.
One point I would like to share, the marketing desk of NMBB, headed by Sauravji, it's very strong now because the cultivation will be promoted based on the requirement demand of the industries, so all over the country. So in the future, I hope as a Deputy Director of Medicinal Plants in NMBB, I can assure that there will be no any hurdles in the marketing of raw materials. So this is one of the points I want to say here. So any other comments, please come over, please.
So I would like to, in order to add on to what Dr. Murugeshwaran has said, we have started creating market linkages for the farmers which are spread throughout the India. And we get our cultivation activity done through our RCFCs, state medicinal plant boards or mission directors, which are spread across India. So now with the initiative of NMPB, now we have created, if I have to talk about last 2 months, in last 2 months, we have created a demand of 70,000 metric ton, and which we have shared with all the implementing agencies, wherein the species-wise demand, along with the contact details of the company persons who are actually taking care of purchase over there, is shared with all the implementing agencies. In case these implementing agencies have already farmers who have cultivated this thing, they can directly sell their produce to these companies. And it also helps us in preparing our future strategies. Like all the cultivation which is done through states, so they come to us with their state annual action plans. So now with the industry demand available to them, they can actually plan the cultivation of those medicinal plants which are actually required by the industry. So this is a new initiative which we have taken over here, and we are getting a very good response from the industry as well.
Okay, I hope there is certain problems, So let me take this opportunity to thank all the esteemed speakers of today's session. Mr. Harvest, Dr. C.K. Katiyar, Mr. Kumar Basu, and Sri Saurabh Sharma. So all they have, we are thankful to them for their wonderful deliberations, and we are looking forward for some future collaborations, and particularly so far if we can enhance our export, if we can make certain very effective collaborations, it will be really worth of the to our efforts to organize this conference, and particularly this session. Dr. Murugeshwaran, I think are you now okay? Your system is okay now?
Not really.
I think not really. So again, I am very thankful to all the speakers, And,
Actually, there were some network issues for some time. I could not able to go there.
Okay. Then you please make a concluding remark, and then actually I have already thanked them. You also kindly being in the chair, please thank them.
Yeah. Thank you, sir. Thank you.
Concluding remarks you would like to make.
Yeah, we have good information. We had a good lecture from all four speakers, Richard House and Saurav Sharma and Dr. C.K. Katiyar and recently and Saikat Bau. So almost all the lectures have been very useful and informative, and it will be useful for our future activities in the medicinal plant sectors, particularly for cultivation and marketing of medicinal plants. Some of the information about the research activities also. So we will go for that, and we will all the points have been noted, and we will look forward to take up in the future activities. So thank you very much for all the participants and all the speakers for your valuable lecture and remarks. Thank you, sir. Thank you, one and all.